Hello, everybody. Thank you for tuning in tonight. I appreciate you taking the time out of your busy life to spend the next hour with us, kind of get a little more education here. My name is Wendy. I'm the owner of Bra Garden here in beautiful Huntington Beach. We are located on the corner of Bolsa and Golden West. You can find out more about us at brawgarden.com. You can also find us on Instagram and Facebook at brawgardenhb. Lots of information there as well. We're very fortunate tonight. As many of you know who have been into Bra Garden before, we really focus on women's health and specifically breast health. We're very fortunate that we have a special guest tonight who is extremely knowledgeable in an area that I hear a lot of questions in the fitting room day to day. Of course, there's a lot of issues we hear about. The most common one lately that I've seen or heard, ladies asking about breast reduction and kind of what that entails and kind of details about that. So I thought it'd be great to bring in someone who is an expert on this to come in and answer questions and kind of give us some more information about that. I'd love for him to introduce himself and tell you more about him. This is Dr. Keyian Paydar.
Hi, hello. Thanks for having me here for your premiere. I'm Keyian Paydar at Paydar Plastic Surgery in Newport Beach at Fashion Island. I'm a board certified plastic and reconstructive surgeon. And the importance of that is that there are a lot of people in this country who are board certified in whatever specialty that they train. However, they seem to want to do cosmetic surgery or cosmetic procedures, and they call themselves a cosmetic board certified surgeon, which may not be the case. So it's very important to do your research before you do any of your plastic surgery procedures, and make sure that whoever is treating you in a safe manner is actually certified by the American Board of Plastic Surgery. Anyhow, it's taken me many years to be where I am today. So my training started way back at UCLA for undergraduate degree, magna cum laude and departmental honors. And then I went to medical school at University of Tennessee in Memphis. And then eventually made my way back to the West Coast and trained in general surgery for 6 years at a premier program at UC San Francisco. And then 2 years of extra training in plastic surgery at UCSF as well. And then I came back to Southern California, to Orange County, and I started working at UC Irvine, where I trained residents for 13 years or so. And a lot of the community doctors and surgeons were pretty much trained by me when I was at UC Irvine. And after that, I went to my own private practice, and my specialty at this point is basically breast and body contouring. I do a lot of breast augmentation, breast reduction, breast lift, breast revision, en bloc capsulectomy, total capsulectomy. I do mommy makeovers, tummy tuck, liposuction, Brazilian butt lift, and face and neck lift. So those are my specialties.
Quite a list.
Yes.
Quite a list, which is exactly why I'm honored to have you here. For those that don't know me very well, my background as well, a surgical technologist for nearly 20 years now. I've worked with quite a range of surgeons over the years. And Dr. Paydar, I've seen wonderful results, which is again why I chose to have him here tonight. So Dr. Paydar, one of the hot topics that a lot of women have been asking me about lately is breast reduction. Kind of what does that mean and what does that entail?
Yep. So breast reduction is also known as reduction mammoplasty. It's a plastic surgery procedure that excises the breast tissue, breast fat, and breast skin to reduce the size and the weight of the breast. It results in a much nicer, smaller, more proportional breast for the rest of the body. So why do people do breast reduction? For the most part, patients with macromastia, which is large breast, either it's genetic or through weight gain, whatever, children having pregnancies, all those things can increase the size of the breast. So they require special bras, which they can come and purchase here at Bra Garden. And so larger breasts require more support, more special bras, obviously. And so patients complain of inability to fit in certain clothing as well.
Mm-hmm.
So there's a lot of reasons why people like to have breast reduction, but truly in plastic surgery, the outcome studies have shown that there's a high patient satisfaction with this breast reduction operation. There's a almost instant improvement in some of their complaints. And these complaints are basically can be anywhere from back pain, neck pain, shoulder grooving from the strap of the bras that are for very heavy breasts. And people get skin rashes from large breasts, or they get even headaches from all the pull and all the extra discomfort. So all those things improve almost instantly with this breast reduction. And that's the reason why a lot of people go ahead and have this operation. So it's not just an aesthetic issue, it's a lot of functional things. It also increases the self-esteem of the patients, their self-confidence. It improves their posture, it increases their exercise tolerance, and overall it improves their psychologic state. So surgery is the only treatment for this condition, as medical therapy such as hormones have really not been effective in the past.
Mhm. I see a kind of bad play on word, a large amount of women that come in that same thing, issues with the back pain, neck pain, pain all over really just from the weight. A lot of that we also help, preemptive before, so not everyone can have surgery, with different bras and making sure they have their correct sizing, their correct fit. Most women are wearing the bras incorrectly. So that leads definitely, you're talking about the divots in the shoulders and they have the wrong bra, the wrong fit. But so in addition, a typical breast reduction surgery. So you would, first you have to do a consult, right? To kind of sit down with your plastic surgeon, ask all your questions. What does that usually kind of entail, just the consult portion of it?
Yeah, basically, I have my patient coordinator, Mariana, who sees the patient with me. And patients come in and they explain what their desire is and what their complaints are. And we go over the whole entire process, why they're a good candidate or if they're not a good candidate for surgery, and what the surgery entails. And I'll go over all that with you right now. Basically, once we choose, the patient is a correct, candidate for the operation, then, patient has the operation, and eventually we'll need to have further support, more bras in the future. And I do some compression after surgery, but we'll go over all that. So the main goal is to reduce the breast size and volume while we improve the aesthetic, more aesthetically pleasing shape at the end. And also there are patients with a lot of asymmetries that we have to also correct at the time of the breast reduction. So for the shape improvement, I discussed with the patient that the areola and the nipples need to be raised along with the sagging breast tissue. For the size reduction, my usual technique is to remove majority of the droopy, sagging inferior part of the breast, in addition to the side boob, in order to basically get the sagging part of the breast out of the way, so that when you close that in the future, there's not much tissue there to cause recurrence of the sagging or large breasts. So it really helps having the lower part. Some people keep the lower part and they take from the top or from the sides. And to me, that kind of gives it more of a boxy breast look. Mm-hmm. So I rather, again, take more from the bottom and from the sides. And then, again, this gives you a little bit more longer, I guess, aesthetic result for a long time, having the lower part removed. As far as the scars that are associated with this procedure, with my technique, you end up having a incision around the nipple and down the middle of the breast. That's where most of the breast tissue is removed. And so the excess horizontal breast tissue gets removed in a vertical direction. As a result, you get a vertical incision. And then the excess vertical breast tissue, especially towards the bottom, gets removed in a horizontal direction. So the scars end up being a lollipop with an inverted T, sometimes an anchor, but it depends on how much breast tissue you remove. Mm-hmm. So by having that excess vertical removed, the breast moves up, the trunk looks longer. And so, it gives this optical illusion that, you're much taller than what you are, because all that breast that was hanging down actually ends up being up top.
And you can see the waist again.
You can see the waist
Looks
again.
Fantastic.
Exactly. Sometimes in some people, belly button reappears again. So,
yes, absolutely.
Yeah. The operation itself takes about 3.5 to 4.5 hours. Depends upon, again, how large the breast is, what the asymmetries are, and how much shape we have to basically create on the table. And it's done under general anesthesia at my surgery center, the Newport Aesthetic Surgery Center. We have a board certified anesthesiologist that comes in and puts the patient to sleep. And basically, when the patient wakes up, they just go home about an hour or so after in the recovery room.
So you have your own surgery center.
I do. So at Paydar Plastic Surgery, I see my patients and we go through the consultation. But day of surgery, they come back and we have a side part of our office where it's the surgery center and it's accredited by Quad ASF. We have very safe procedures done there at the surgery center.
That's great. Then you're not worrying the day of surgery, trying to find the surgery center and worried about being late. You already know where to go.
Exactly.
That's fantastic. That's fantastic. Now, a question I have for you, some of the ladies that I have seen post-surgically, not your patients, but others, and kind of an issue that many women have had. We're talking about the breast and then reducing the size of the breast, but after that, having a lot of side tissue remaining on the side of the body and having it almost looks enlarged because everything else now is so small or smaller. What can be done to kind of bring that, because that's not part of a breast reduction, right? That's kind of an additional.
Well, it depends. So
Okay.
again, doing the operation the correct way the first time is the most important thing. So if you go to somebody who doesn't do it very often or does the wrong way, you end up having certain looks that you're not going to be comfortable with, and then you have to have a revision surgery. So it's not a straightforward operation. So again, patients have different types of breasts. So some have a lot of extra tissue, whether it's fat, whether it's breast, to the side of their breast, into the armpits almost.
Mm-hmm.
So you may require liposuction at the time of breast reduction to get rid of that extra tissue that you have there. Sometimes, as I mentioned to you, people who leave the bottom of the breast and they take from the top or around, you end up getting a boxy looking breast, which means it settles down and it's sort of a bottomed out look. And as a result, the sides start, showing more. You have dog ears that go all the way to the side.
Mm-hmm.
And so again, that requires revision surgery. So what do you do for that? For the most part, if you don't have to do liposuction, if there's not much tissue on the side, but there's that extra dog ear, you have to cone the breast more. And so you have to tailor tack the breast incision a little bit more. Again, it's the revision surgery.
Mm-hmm.
So if you do it the right way, I think the first time you should get a very good result. Again, I leave most of the breast tissue up top because I like to have that fullness, the nice cleavage.
Mm-hmm.
At the same time, I take from the bottom so you can get a nice coning and get a rounder, prettier breast to avoid those kind of situations where you see where people have extra tissue on the sides or in the armpits, or have dog ears, which is extra skin hanging on the corners of the incisions.
Absolutely. And I definitely agree. The fullness in the top of the breast, that's something that we also, achieve with a lot of the bras here as well. Definitely both for support and for the aesthetics, a goal of the majority of women. And so when you get that shallowing and get, it's not necessarily usually the desired look, especially if you've had surgery and you've paid for it. So I appreciate the fact that you take the time and really keep and help maintain that to the best possible, right? And yeah. So now, as far as recovery after surgery, and now I know you were saying it's more or less an hour after you wake up right after surgery, but long term, now you've gone home, and kind of what's the care over the next few days or a week after?
Yeah, so the recovery is pretty short when it comes to this operation. The majority of the operation is done above the muscle, and so there's not that much discomfort. People have breast augmentation, you have to detach the muscle, and so that's where the pain or discomfort comes from. If you do a tummy tuck, you have stitches that go up and down your muscle, and that's where a lot of the pain comes from. In this case, it's all very superficial surgery. So the recovery is very quick. I would say it just, in a couple of days, patients can go back to their normal activities, not heavy duty. Within 2 weeks, I would say patients can go back to normal exercise. Again, not heavy duty exertional exercises. By about 6 weeks after surgery, you can go back to pretty much unrestricted activity. As long as everything's healing nicely, the incisions heal. So it's pretty straightforward. It's only a few days of just downtime, I would say, where there's some swelling, maybe some bruising. But I do wrap the breast with a wrap the first few days. I don't use drains. Some people like to use drains. The way I tighten the breast so much, there's really no dead space for the fluid to collect. And the compression really helps against that too. Do you have anything that actually can help patients with that in case they come out of the wrap in the beginning?
I do. We carry compression bras, compression garments for the whole chest, actually, and torso as well. Now I know as compared to reconstruction surgery, where then we're working with removing lymph nodes or different things as far as breast cancer. That's not really the topic tonight. We'll get into that another night, as far as using sleeves and different garments like that. But yes, we do have the compression garments here, post-surgical bras, exactly, that people could use afterwards. Anything from right from the OR table all the way through. Okay, so breast reduction. And you've done, I don't even know, countless numbers of these.
Yep.
A lot of experience in this. What would you say, most women, when they come to you, what are kind of their expectations? Or do you think that they understand what the results, it's not really as easy as saying, I want to be a D cup when I'm done, or I want to be, it's not necessarily maybe a certain size.
Yeah, it's a very complicated discussion. And so it's one that we have to see the patient multiple times. The first time during consultation, next time during preoperative visit, we go over multiple times because people's definition of certain size or certain look is different. Some people say, I want to be larger, but they're trying to say is they want the breast in a better position, a little bit higher up, for example. People's ideas about bra cups is just all over the place.
Oh, yes.
So I'm sure you know a lot more about that.
Yes.
What kind of how do the bra cups go? I don't know if you want to talk about it right now or not. But we have to discuss, that it's not guaranteed to get a certain cup size, because sometimes body's habitus does not allow us to get a certain cup size. But the main point for us is to reduce the breast as much as possible, minimize the volume as much as possible, to give that symptom relief. That's the most important thing. In addition, make sure we do a very nice job with aesthetics to get a pretty breast. One thing that comes up is they want to use their insurance, for example, for this operation. And I used to, do this under insurance as well, but there's a lot of requirements by the insurance companies to remove a certain amount of breast tissue in order for it to qualify to be covered by the insurance company. Unfortunately, sometimes, you lose the shape of the breast when you pass a certain amount of volume that you're removing. And so I like to sort of stop before that happens sometimes and actually make a nicer looking breast. And I don't want to be forced into taking out more breast tissue in order for the insurance to pay me. So I've, many years ago, I decided not to take any more insurance and, do this pretty much with cash kind of operation, but get the best results for the patients. And, some patients decide to go with that, and some patients just rather just save some money and go with insurance and hope for the best at that point. But what is your understanding of the cup sizes and what's out there as far as different type of measurements out there for the cups?
Oh, gosh. Well, cup sizing, bra sizing in general, there's been studies that have shown, at least 80%, it's probably significantly more than that, of women are wearing the wrong size. Just not understanding the structure of the bra, how it works, how it should be worn. So the majority of women that come in are usually pretty far off from what they should be wearing. Cup sizing, again, like you're talking about, the post-surgically as well, the body frame has to be able to hold and maintain a certain size as well. And so a large amount of ladies that come in that think, maybe I was a 38B, and when they leave here, maybe they've discovered, no, they're actually a 34F or something, along that line. Cup sizing, of course, when we do the whole sizing, the whole bra, we have our appointments here. We go over with, I would say patients, guests, exactly how the bra fits and why we're putting them in the size that we are, so that they understand when they leave too, that, oh my gosh, I had no idea that there was a double G, or I had no idea in US sizing, we go from a double A, we go all the way up to an O cup. Most people don't know it goes that large, and most stores won't carry that. It's something that's difficult to find. And I think that's why a lot of women love coming here, because we do have these items on hand. We can fit you and see what truly fits your body frame and put you in something same day. You don't have to order anything online that's not going to fit and return it 50 times. All these poor women, we've all tried to do that, order clothes online and send it back. It doesn't fit and it doesn't. Here, it fits, before you leave the door. I wanted to throw out there quickly, if anyone, while you're watching, if you have questions that you would like to submit in the chat for Dr. Paydar, we'd be happy to answer those as well. So feel free to put any questions in there.
What you mentioned about, same day fit is so important, especially post-surgical patients, waiting for their support to come days after. It just kind of freaks me out a little bit, actually.
Yeah.
I just worry about the results sometimes. I want to make sure that they have good support. That's why I always want to make sure they come here, for example, before their surgery, so they can select out what they may need for after surgery, so they don't go without support. So that's going to be very important in the healing process. I was just going to touch up on a couple of things about who are the best candidates for breast reduction. So patients must be in a good state of physical and mental health before having any surgery, whether it's breast reduction or any other plastic surgery we can talk about. There should be non-smokers, because smoking really hurts healing.
Why is that?
It's just that the blood supply that is needed to create that, scar, to create that incision for it to best heal. Nicotine that's in the smoking that people do, whether it's chew, if it's patches, or in a cigarette, that nicotine makes those blood vessels very small and doesn't allow good blood supply to come and heal the incision. So people may have separation of their incisions, or as a result get infections. So it's going to be very important for people not to be smoking. It's elective surgery. It's not like an emergency surgery where they have to have it next week. So we want to make sure they stop smoking for about 4 to 6 weeks before the surgery, and also after surgery as well. Also, we want to make sure that there's no excessive alcohol drinking. Sometimes can cause some bleeding post-op. This is not an age-specific kind of operation. So teenagers, when the breast tissue has stopped developing, they could be candidates for this operation. Or even grandmas, in their 6th or 7th decade of life, could potentially come back and have their breasts reduced to decrease their symptoms. Patients obviously have to have symptoms for their large macromastia, large breast, to be good candidates for this operation. And they should have realistic expectations, obviously. It's not a straightforward operation, and so there might be some revisions in the future to adjust, a couple of things about the scar, or sometimes, you may have more droopiness again that might need to be tightened. So again, it's patients with unrealistic expectations may not, be good candidates for this operation.
Now, how often does it occur if someone, I know obviously through life, our bodies all change. Our hormones are changing. Gravity is not a friend.
Friend of plastic surgeons.
And so how often is it very common, if you have maybe a breast reduction younger in life, to maybe needed, obviously skin's going to loosen, right? So a little tightening later in life, maybe, but is it a common occurrence for maybe the regrowth and have to have a second reduction or a third reduction, or does that happen?
I've heard stories about that. Patients come and ask me that question. I haven't seen it in my practice.
Okay.
So I don't operate on patients who will continue having larger and larger breasts. Young patients, for example, we have to wait until the breast stops growing. And once that they stabilize at a certain, breast bra cup, that's when we operate on them. Now, if anything changes, such as pregnancy, or, they increase their weight, so that can add some volume to the breast. So that you cannot really control unless, patient continues with good exercise and good diet habits, for example. Also, as far as recurrence is concerned, sometimes it's not the enlargement of the breast that needs to be treated again, but sometimes this droopiness can happen again. People who have stretched out their breast, it really damages the skin sometimes, and you see these real large, thick, deep stretch marks on their breast. And so I tell them automatically that there's a good chance that they might have to have revisions down the line, 5-10 years down the line, potentially, just because the skin may not really hold up very well. And then there's some patients that have very good skin, especially the younger ones. And so they may not require, any type of revisions for many, many years or decades. But the fact that they're younger, and the fact that they're going to have basically children and pregnancy and so forth, maybe weight gain in the future, they're also at risk of having potential revisions in the future.
You brought up a great subject, actually. So pregnancy. Now, if you have a breast reduction, does this have any interference with nursing in the future? Maybe you are younger and then later have kids. Are you still able to nurse?
Well, again, the functional part of this operation where we try and maintain the function, such as breast sensation or breastfeeding, is to avoid, cutting certain parts of the breast. And again, that's part of the art where we do the breast reduction. But yes, the more cuts you have through the breast, then there's a higher chance of having an ability to breastfeed. Now, there is a certain percentage of patients who are not going to be able to breastfeed no matter what. And I say that to my breast augmentation patients, especially. So you don't really know that ahead of time.
Mhm.
And so it may decrease your ability to breastfeed by 10, 15, 20% potentially in those cases.
Okay. So, okay, well, we've talked a lot about the breast reduction, and you were saying also, you kind of mentioned breast augmentation. That's obviously the opposite, and we'll kind of cover that more, I'm sure, on another night as well. Now you were saying that you don't use drains, or now as far as pain management, something like that. You were saying how since you're not really you're not going through muscle, it's not an extremely painful surgery. Of course, it's going to be uncomfortable.
Yes.
As far as you're saying downtime, missing work, what's kind of like an average? You miss a couple days, you miss a week.
Yeah. So again, depends upon what what kind of work the patient does. If it doesn't require too much heavy lifting or reaching for things, after I would say about a week or so, you can go back to work. Similar with breast augmentation. Usually that is a recovery for about 2 or 3 days, I would say. People can go back to work. Breast reduction is almost similar. Now, people who use drains, they may require their patients not to go to work for much longer than that until the drains come out.
Okay.
Not having the drains really helps. Patients are really much more comfortable. There's less discomfort. Plus, I also give patients local anesthetic at the time of the operation, so they don't really have much pain after the operation. And most people have very good pain tolerance in addition. And after surgery, about the next day or two, they're back to basically just maybe taking Tylenol or Motrin, or not even taking any after that even. So most patients don't use narcotics after the surgery. If anything, Tylenol or ibuprofen for a couple of days, and then they're back to doing normal activities within 2 or 3 days, going back to work within a week to 2 weeks max. And then again, getting back to exercise at about 2 to 3 weeks after surgery, and then no restrictions about 6 to 8 weeks after surgery. So it's, they feel so much relief right in the beginning. There's less neck pain immediately. They feel like some major heavy, weight has been lifted off their shoulders. And so they're
Literally.
happier. Yeah. And they're happier. They go back to work, a lot sooner actually.
No, that's great. That's great. Again, I've seen many women in the shop that are carrying the extremely large, amount of weight. And again, we have quite a few chiropractors and physical therapists and different, outlets that refer people here. Again, because if you can't afford the surgery, or maybe you're not there yet, maybe you're not sure, maybe you're still going through your consultation period, and you're, again, really getting that correct fit and getting everything lifted again. We were talking about being able to see your belly button again, and that's the same thing with a good bra as well. Getting all the tissue into the cup and getting it up and getting the weight distributed evenly on your body again, where it's not pulling your shoulders down and not pulling on your neck and hurting your back. And that's another thing that we go through with our appointments here, how to properly wear it and keeping your band low in the back. All my ladies that have been in, they all know the drill. Keep the band low. We talk about how it's like a teeter totter, and how if your band's going up in the back, you're falling in the front. And then there's the weight again that's hurting and pulling everything down. Pulling all these ladies that have been in, pulling your side tissue forward, and all the tricks that we go through, and just to get everything into the bra properly, and learning about the support and the corrects. But there comes a point for some ladies where it's just too much. It's too much. They've dealt with the weight over time, even with the lift of the bra and everything. It's still, they're tired. They're tired of dealing with it. They're heavy. They can't sleep right because they're rolling over, and they can't, do certain exercises, and they can't. And that's where this is why I wanted to bring you in. I'm so grateful you came in and explaining everything. For the women that are frustrated and they become depressed because they can't do the things they want to do. They can't wear the clothes they want to wear. Some of the ladies, I don't want to say it depresses them. I'm not a clinical psychologist or, I can't, but you definitely see a difference.
No,
Both
I mean,
with
as I touched upon it earlier, and psychological improvement is a known thing from the outcome studies. Let me ask you a question. So when patients actually wear the appropriate bra
Mhm.
and the way the breast shifts while it's still pretty much large, does that ever change the way they wear their clothes? They fit better in their clothes by having a bra, or is it no matter where the breast sits, whether it's drooping or whether it's sitting
Oh,
right?
it definitely makes a difference. It definitely makes a difference. Getting everything lifted up again. Many ladies, especially if they have specific dresses, maybe, or a specific blouse, or maybe a wedding that they're in, or some special event, and they have this specific thing that they want to wear, and they just can't get into it right. And we ask them, bring your garment with you, come and try it on. And 100%, it's the founder of Bra Garden, Kathy Zutz. Wonderful. I learned so much from her. She's amazing, board certified mastectomy fitter, and she was great at talking about, you start with your structure. That's your foundation on your body. Everything else drapes over that, right? So now we've got you lifted. Now maybe the dress you had before isn't touching the floor anymore, and now you can see the waist again. So now you're going to we have a wonderful alterations lady, luckily in the same parking lot here. And we send a lot of ladies, not for their bras, but for their dresses. Because once now they're in it, the whole thing changes, and it's very interesting. We see a variety, of course, of ages of ladies here, and anywhere typically from about middle school all the way up. And my younger ladies, we try to educate everyone while they're in here, just the hygiene and breast health. And we touch a little bit on blood flow and things for the people that want to listen, that don't get bored of me talking, And with my younger girls, especially, it's nice. It's really everyone, but to have them young, learning, the proper things at such a young age. I had one young lady, she was so sweet, and she was in 7th grade, and she came in. It was her first fitting. Her mom brought her in right before, school was starting. And she kind of developed over the summer. She's a little embarrassed. She's going to have PE, and she's not quite sure and she came in, it's cutest thing, had this pink flamingo stuffed animal. Super nervous. She had never been fitted. She doesn't know what's going on. It's embarrassing. There's bras. I can't believe my mom brought me in here. This is, and she's wringing the neck of this flamingo and just wringing it. She's so nervous. And we go in the fitting room. And of course, with our younger ladies, we do things a little bit different as well, but explained, this isn't a doctor's office. Nothing hurts. No offense. Nothing hurts. There's no shots. There's no, and got her into some things for school that she was comfortable in and felt confident in. And by the time she left, she's skipping around the store with her flamingo and happy.
That's wonderful.
But it's all ages. I have, I won't say any names. I had a wonderful lady in here about 3 weeks ago, maybe. And she's 82. And didn't look like it, amazing. And we're fitting her into her bra and going over how you put yourself into it, how to adjust it, she's like, I can't believe I'm 82 years old and I never knew how to wear a bra the right way. Like this is
82.
So it's all age, but yes, absolutely. When you have the right foundation and the right structure, and it gives you the confidence. We definitely see a difference between the ladies that walk in with something that doesn't fit and they're slouched over and they're not happy and they can't find anything. And we get them into some nice things. And it's very common for ladies to walk out in their new bra because they don't even want to put their old one back on. And when they leave, they have the shoulders back and they're confident and they're happy and they're smiling. And, I finally found a place that has my size. No one has my size. No, you're not going to. So it's kind of the difference as well, is having everything that's beautiful and lace and sport and strapless and then also combining the medical side of it, and having the compression garments and the post-surgical garments and the prosthetics for our cancer patients, and everything breast related across the board, that you can come here and we'll be able to help you in every way.
Well, that's very
Um,
important. No,
and
I'm sorry, but obviously you have a lot of medical knowledge being in the operating room and being with plastic surgeons and doing these cases and seeing things, firsthand. What are your qualifications for the people here to know that makes you very the right person for them as far as when it comes to getting fitted for the bra? You mentioned certification.
So yes, so in addition, so I've been surgical technologist for almost 20 years now. So yes, I have firsthand assisted. I don't even know how many breast reductions and breast cases are probably, I'm sure, in the thousands, but through the years. And then also board certified mastectomy fitter as well. I have another fitter. She's not here tonight, Brianna. She's wonderful as well, who is finishing her boards is too. So it's kind of, like I said, not just getting things that are pretty it's great. And when it's men probably won't understand, but for a woman, it's wonderful to get up in the morning, put something beautiful on for yourself. And you could look in the mirror and you're happy and you look beautiful, but also, all the way through, life happens. And sometimes you go through things that maybe weren't expecting and weren't all the way around. But like you're saying, weight gain and hormones and menopause and kids and all these things that
Breast
change our
cancer,
body, breast
mastectomy.
cancer, absolutely. And so we all walks of life, we try to help all the way along the way.
That's wonderful.
So you were saying you did both general surgery and plastic surgery, right? Is that
Yes.
correct?
Yes.
So having kind of the knowledge of both of those really puts you above and beyond, right? So
Well, if you think about it, body works, as a whole. So knowing the principles of surgery, how to operate, it really helps and build, your foundation when it comes to subspecialties such as, let's say, plastic surgery or ear, nose, throat. So in the old days, you used to do just general surgery first, and then after you finish general surgery training, then you would do plastic surgery. Now, most of the programs are combined programs where you automatically enter into plastic surgery, where you do 3 years of general surgery and 3 years of plastic surgery.
okay.
But the requirements back when I was training was basically at least 5 years of general surgery, 1 or 2 years of research, and then you finish your training, and then you would move on if you want to do subspecialty training such as plastic surgery, or if you want to do something else, for example, like vascular surgery or transplant surgery. So there's all those options, but it just makes a lot of sense to get the basics done, and then build up upon the foundation that you build in general surgery.
Yeah, absolutely. Which led, you said, at UCI.
Then I came to
Okay.
UCI.
And so UCI, what did you do there?
Again, I was teaching plastic surgery, so I was performing operations, reconstruction, cosmetic operations, and I was teaching residents at the same time. So for 13 years, when I became professor in plastic surgery, I was training many residents who eventually graduated and then became community plastic surgeons in Orange County now. So
Okay.
there's a lot of the guys that I've trained that are actually out there operating and doing a good job, actually.
Well, that's great.
Yeah.
That means you did a good job teaching too, right?
That's the thing, you get taught many years, you go through a lot of training. And so my job was to, pay it back and teach people things that I've learned from some of the best surgeons in the world, actually. So it's, one of those things that's more rewarding to teach your technique to people who actually can use it and pass it on to the next person.
Oh, yeah.
Yeah.
No, absolutely. Now, again, going back to you have your own surgery center. This is kind of not a very common thing.
Sure.
Most surgeons, I would say, either have to go to the rigor mortis of going through a hospital, right? And trying to get scheduled out, maybe hopefully months in advance, maybe, I don't know. And or booking in larger surgery centers and kind of being a number for the day, and kind of with all the other surgeons and the craziness, and your family doesn't even know where you are. And so kind of what's the difference for you to be able to have your own center, you said, is Quad A,
Quad ASF.
Quad ASF.
Yeah, it's
That's-
accredited by the body there that oversees small surgery centers to make sure that it's a very safe place to operate for patients. Yeah, it's patients always tell me when they have had previous procedures at the hospital, there's one of many people who showed up. There's always a chance for mistakes because there's multiple patients around.
Mhm.
Whereas at my surgery center, you're just dedicating all the attention to just one patient, really. I have one operating room. Whether I'm operating, whether somebody else is operating, it's always focused on the patient.
Mhm.
And again, we have board certified anesthesiologist that comes in and puts the patient to sleep. We have a registered nurse and a scrub tech that comes in. So it's a nice little small team, and it's very sort of like cozy and family oriented almost.
Mhm.
And so patients have very good experience every time they have an operation over there.
That's great. Now to find you, you said you have a website. What
Yes.
is the website?
It's paydarplasticsurgery.com.
Paydar Plus. And now are you on Instagram, Facebook, anything?
At
Are you
Paydar MD is my handle for Instagram. Yes.
Paydar MD?
Yeah.
Gotcha. So if I go to Paydar MD, then do you have any pictures? Do you have anything people can see? Do you-
Yes, we have pictures, we have stories, videos of previous operations, whether it's breast reduction or breast augmentation, mommy makeovers. It's all there with some short story about the patient, so people understand, what the problems were before, and they can see the major transformation afterwards. So it's good to take a look at those things prior to, coming for consultation to make sure you know what you're going to get eventually. Not every patient is different, obviously,
Right.
but you get a pretty good idea as far as the kind of work that the surgeon's putting out. People say don't go on the internet because you might get scared of what you see. I feel like it's important to go out and see what people are posting, because you'll see what the surgeon thinks might look pretty, and so you may not agree with that. So you got to sort of cut your losses short before you even get there.
Maybe their technique, or maybe now, is there a way, probably not, maybe, to find out if these pictures are real? If they're really yours, if they're someone else's,
Yeah,
if they,
no, there's a lot of questions about, what's real, what's not. Sometimes, people steal other surgeons' photos and put on their websites. Unfortunately, I try to put watermark on my photos before and afters
Mhm.
on my social media, so people know that that's mine. Some people try not to steal
Yeah.
the photos. I'm sure that's a terrible thing. People have to deal with theft, whether it's on the internet, digital, or whether it's in person.
Absolutely.
Yeah.
Now, do you have, if someone during their consult, if they want to see something in the office, you have pictures as well
Yes,
in the
I do.
office that they can see that's yours firsthand, and they know it's not fake, right? And
Yep. No, I have a whole set of my website has a lot of photos, my Instagram has photos, but my own, when you come to the office, I have a lot of before and after photos of patients. That's just not even what you see actually on the social media or website. Because when I talk to a patient in consultation, I look at their body habitus and see exactly, what they look like, and try and find a patient with similar, body habitus
Mhm.
or same ethnic background, for example.
Mhm.
Some people scar more than others, so I have to bring that up during the discussions and so forth. So it's good to kind of look through a lot of plethora of photos and trying to find what might resemble, the patient and potentially their final outcome.
And something that over the years that I always respected with you as well is your honesty with patients and with people in general, but especially with patients. Truly what the expectations are, what they're going to go through. And honestly, if you can help them, cannot help them, all the way across the board. So when they leave, they feel confident and knowledgeable. They don't leave with a lot of questions or a lot of uncertainty, or, I've had quite a few of your patients here, and they've all been happy and they look great, I have to tell you.
Thank you.
But they all have wonderful things to say, and you and your staff as well, and how they really, like I said, the honesty really came through, and all your intentions were true, and great results.
Thank you.
So,
No, I mean, when there's consultation, it's opportunity for education. And so we go over a lot of different things very quickly. And I always double check, make sure that, they understood what we went over,
Mhm.
because it's a lot of information, first time hearing it. Now, some patients have done their research ahead of time, which makes it a lot easier. And I always suggest for patients to do that ahead of time. Read about it, have questions when you come in so that we can actually tackle those. But yeah, I feel like educating the patient's important, and sometimes patients realize that maybe there's not an issue to worry about and not have an operation. I don't operate on every patient that comes in. And I do my best to ask myself questions. Why should I not operate on this patient? Why should I not operate on this patient? And so if they check a lot of boxes that they need to have the surgery and they're going to get a much nicer result and get a nice transformation, I feel like they're going to be really happy at the end, and I will offer the operation. So my wife hates it when I say like no to a lot of my patients when it comes to having surgery, but I feel like I can sleep a lot better at nighttime, knowing that I'm operating on the right patients. And I do the best I can, use my artistic abilities, spend time in the operating room, never rush, and do what's safe. That's very important to me.
Absolutely.
Yeah.
Patient safety always.
Yeah.
That's our
That's
our motto.
That's right.
Patient safety first. Or that you brought up a good point of the art of it, right? It's not a matter of cut here, put this together, whatever, and done, and voila. There truly is an art to it, and getting the correct contours and getting the right curves and getting the proportionate of the body. And so I definitely have seen a variety of that, both in the operating room throughout the years and in the shop as well. So I definitely think that again, the artistic side and in the photos, like you were saying, is a great way to see like this. More or less everyone's body's different, of course, like we discussed, but we'll kind of give the general idea of what to expect when you're done. And what not to expect, maybe.
No, it's important. I mean, I'm sure the famous sculptors and artists, didn't paint like their best painting the first time they painted it or sculpted it. So it's important to go back and look at your first few patients. Every time I do a case, I still go back, I look at the before and after photos, and I always ask myself how I can make this even better next time. So some people are satisfied with the results. Some people, I'm never satisfied with my results. I can always find a thing or two that I could have done better under whatever condition, because you never prepare fully when you operate on somebody. There's always potential surprises. And so how you react to that, and how you can actually create the final result, is important. And just look back at your own work and try and make it look even better next time. Really, I always taught that to my residents too. Always look at your photos. Don't just take photos and just put it in your computer just because you have boards that need to look at the photos, which is part of the whole grueling process of becoming a board certified plastic surgeon. But anyhow, yeah, it's important to look at your own work and criticize yourself, be the worst critic, yourself. And so you can become even better at what you're doing.
No, it's great. Continually growing.
Yep.
And everything always changes, technology, everything, same thing with surgery, right? And different techniques and different, the same thing, again, I know I keep going back to the bras, that's my world. The structure and the technology in the bras as well, always changing. I just went to another expo in LA for Curve, and just seeing kind of what they're developing and what's coming down the line and how they're improving bras. That same thing that maybe they had issues in the past, that now they have the next line, the next level, the next, it's always exciting to kind of see. And same thing, you don't just maintain the same old thing all the time. It's always kind of progressing and growing with the next.
That's right.
And do we have any questions out there?
We do. Yeah, someone asking, do you recommend reduction for someone who has fibromyalgia?
We want to. So the question again, do you recommend breast reduction for someone who has fibromyalgia?
That's a tough one, because there are certain conditions that there's no guarantees that pain can improve. For example, when it comes to breast augmentation, people talk about breast implant illness, for example, and it's a lot of discussion about it. And truly, just taking out breast implant may or may not help patient. And this is another condition, fibromyalgia may not get better by just doing breast reduction. So people who actually are the best candidates are the ones who actually have symptoms of back pain and shoulder pain, and that's sort of like been validated by sometimes orthopedic surgeon, that there's reason to actually do that operation. Fibromyalgia is a tough one, because not everybody gets better after that. So I will never guarantee a patient getting better with fibromyalgia with breast reduction.
Okay. Good question. Are there any other questions? One question. I love it. This is wonderful. I'm so excited. This is our first session of Breast Talk. And Dr. Paydar, we're so honored to have you here in the shop.
Well,
I
thanks
know
for
you're
having me.
so busy.
I'm so excited about your bra garden. Yeah.
And yeah, it's great that everyone, again, thank you so much for taking the time and staying with us for the last hour. Hopefully a lot of your questions have been answered. If not, again, you can reach Dr. Paydar if you have further questions.
If you have any questions, you can call the office at 949-755-0575, or you can go through our website at Paydar, www.paydarplasticsurgery.com, or through Instagram at Paydar MD.
And for us, it's with Bra Garden here, same. If you have any questions either for us regarding bras or post-surgical or anything breast related, or if you didn't write down the number fast enough and need to get a hold of Dr. Paydar, either way, you can always give us a call here at the shop. It's 714-842-2414. You can reach us on Instagram or Facebook at Bra Garden HB. You can visit us on our website, bragarden.com. You can visit us here at the shop. We're on the corner of Golden West and Bolsa. And again, Dr. Paydar, such an honor. Thank you so much for taking the time.
Thank you.
Thank you, everybody.
Thank you. Bye-bye.